A warm greetings to you all. I'm Ategeka Proscovia, a counselor, author, and inspirational speaker. Today, we are here to learn how to take care of an ill person, a dying person, or a person in his final stages of life. That is so because most of us, when a loved one is diagnosed with a fatal illness, we really become devastated. So, amidst intense fear and extreme anxiety, we should always apply the following ideas to make the patient comfortable as we prepare for the road ahead. Take good planning. If your loved one is still able to communicate and willing to address any issue, ask the patient of whom he or she would like to be making decisions on his or her behalf when he is no longer able to do so. Go ahead and make frank discussions of how the patient would like it to be treated. Does he like it to be resuscitated, hospitalized, or submitted to certain types of medication, like home remedies, like prayers, or any other? The major role of a caretaker is to provide comfort. You can always provide comfort to an ill person in the following ways. Sing or read to them by choosing literature which is comfortable, enjoyable, and upbuilding to that particular patient. Besides, most patients feel comfortable when a loved one holds their hands and talks to them in a very respectful way. Please do so. And if the patient is a believer, go ahead and pray together. A heartfelt prayer during extreme stress and serious illness is so invaluable. Important to mention also are some of the symptoms that most patients exhibit and how to help them. Lack of appetite. Most patients neither like to eat nor to drink. They normally dry their lips and foam on their mouth. We can always help them by swabbing glycerin on their lips and placing a moist washcloth on their forehead. Most patients like to be alone or with very few people. It is always very helpful to keep their environments calm and quiet to the extent possible. Most patients seem to be confused. Rather than restraining restless emotions, it is always good to talk to them in a calm and reassuring way. Important also to note, most patients like to be clean. Always keep their bodies clean and their environment tidy to the extent possible. Acknowledge the reality. The very notion of a loved one dying is so distressing. For we were not designed to accept death as a normal part of life, as quoted in the Bible book of Romans. Nevertheless, anticipating on what may occur can help family members to ease on their fears while focusing on making things as comfortable as possible. Thank you.